Hi there, my name is Dr. Raj Chovatiya. I'm an associate professor at the Rosalind University of Medicine and Science and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago, Illinois. It was a true privilege to present with my panel at Maui Derm 2026 about all the updates happening in atopic dermatitis and pruritus. Now, it's hard to really condense down this action-packed talk into a few pearls to take away to your practice, but I'm going to do my very best. So first and foremost, number one, think about regional specific disease when it comes to eczema. In particular, this past year has been marked by a lot of updates in a newer disease state for many US derms, chronic hand eczema. We've seen the approval of our first topical therapy, or any therapy for this condition, topical delgocitinib. We've also seen readouts for some systemic therapies like tralokinumab, all suggesting indeed there might be specific ways to target a complex disease like chronic hand eczema through topical Janus kinase inhibition, but also through systemic therapies like biologics. In addition, we've also seen additional data for topical ruxolitinib for chronic hand eczema, another topical JAK inhibitor. So stay tuned for more updates with what's happening as far as the hands go. Secondly, we've seen some major advancements for pediatrics. So topical ruxolitinib, a topical JAK inhibitor, was approved down to 2 years of age. This was a huge leap forward for topical therapy, especially with Janus kinase inhibitors, where there's been some concerns about potential safety-related events. I think this is going to have a huge impact on individuals to have a lot of improvement of itch as well as rash when thinking about atopic dermatitis in our youngest kiddos. Finally, I'll in totality talk about what's happening in atopic dermatitis. We've seen a lot of confusing results and misses in terms of our newer therapies recently, highlighting the fact that this disease heterogeneity concept in atopic dermatitis is real, but not necessarily one where we have the right answer. Some of the most exciting updates coming forward in terms of pipeline treatments include multi-specific antibodies that are trying to go after multiple targets, some of the continued work into checkpoints and or co-stimulatory molecules like the OX40 ligand and OX40 receptor, and other types of treatments that are taking a completely different approach. For example, Respeg, an IL-2 agonist that's activating regulatory T cells to try to resolve inflammation. Bottom line, a lot happening in atopic dermatitis. This decade of dominance is not done yet. Expect there to be way more fun stuff happening over the next few years.